My name is Tracey Jewett-Perrizo, and I came to OSI for physical therapy on my shoulder. I have been to a few other physical therapy places, and I wanted to try something different. Experience-wise, coming to OSI is far above any expectation that I would have any other place. Everybody is very kind. Everybody is very cheerful. They know you by name. You're not a number. They give you your information up front. They are very forthright in letting you know what is going on and what is going to happen. You get a goodbye, you get a hello. You don't get that every day from any other place. You're just a number. Here, they know your name. All the exercises that were recommended to me, they helped tremendously. And then I also was introduced to dry needling, which worked miracles. It's a night and day procedure. It makes you feel just totally different the next day. I came here with a scale of 1 to 10, pain-wise being a 10. I left after dry needling and it became a 1 or a 2. So I would highly recommend it. Don't let the needles scare you. It sounds scary, it sounds painful, but it's not. It's a miracle worker.
So today we're doing some dry needling, and I want to tell you a little bit about what it is. So dry needling is not brand new, it's been around for a while, but there's some emerging research coming out about it, and there's going to be more research coming out in the near future, and it's becoming much more common and practiced by physical therapists. What it is a form of intramuscular therapy where physical therapists and medical doctors use acupuncture needles to get into muscles that we can't get into with our hands. So we're trying to get into taut bands, trigger points, areas of muscle dysfunction, so that our other therapies, our other manual therapy, exercises, patient education then become more effective.
I knew absolutely nothing about dry needling, never heard of it, never knew there was such a thing. After, I recommend it to anybody that's having pain in their shoulders, their backs, any sort of pain you're going through, discomfort, I would highly recommend it. Working with Tony is an absolute blast. He is very upfront, he's very personable, he is concerned for your benefit, not just an everyday kind of guy. Here's the papers, you go home and do your exercises. He will walk you through them, make sure you understand them, and then ask you if you have any questions versus here's your paper, there's the door.
So typically with dry needling, it's anywhere between 4 to 8 sessions. And in addition to the needling, we're still doing other things. The needling is in isolation. We're still trying to get at what caused the problem in the first place with exercise, other manual therapy, patient education.
He's very understandable, very likable. I've never experienced a better physical therapy session than with Tony. If you ever are considering going to physical therapy, I would highly recommend coming to OSI. I have been to several different locations, not OSI related, different companies, and there you just don't get the quality that you get at OSI. Here you're a human being, you have a name, you're not a number. This sounds cheesy, but it's true. You have to experience it for yourself. That's the only way I can explain it to you. Just, you're worth it. Come to OSI.